And thank you. For-profit healthcare greed has been normalized in this country. And we find ourselves confronting all these problems, these shortages of providers, these very low reimbursement rates. And yet we still rely on large hospital systems. We still rely on institutions that ultimately are not really proponents of home-based healthcare. Public health in this country has been dismantled slowly over the last 30 years. Infrastructure as well, in terms of the number of accessible clinics that people can go to, clinics that have more cost controls. And so here we are, post-pandemic, and nothing has really changed in terms of the narrative. I'm a believer that healthcare is a human right, but it should manifest in structure. And so using ARPA dollars, we should be rebuilding our community health infrastructure, which serves our older Rhode Island residents. And as we build that structure, we should really focus on cost controls around certain pharmaceuticals, based on basically the state taking control of its procurement process and extended rebates to all Rhode Islanders to reduce the out-of-pocket cost that old Rhode Islanders are paying, and young. And also, when we think about moving forward, we should really, yes, talk about increasing reimbursement rates for providers, but that doesn't change the overall shortage of providers. We need a state-based medical school that has a 3-year primary care track that creates more dentists and medical providers, a dental and medical school. We can model it at the Quinnipiac University. If we are producing more dentists and physicians from Rhode Island, in Rhode Island, that's how we create the providers necessary to serve all of you. And in addition to that, the Rhode Island Promise program and all these retraining programs that we have, yes, we need to increase the pipeline, but Bob Scapini in Central Falls High School, where I graduated, was working for 5 years to create a CNA program for high school students. Not so that they could choose that as their permanent career, but so that they can come out and at least do some good work in healthcare. And no one helped Mr. Scapini at the state level. It's important for us to recognize that there has to be a will when there's resource. And there's resource. As governor, I will have the will. Thank you.